Training Academy in training nurses in nursing competitive exam as well as IELTS and NCLEX and OET training. Again, I am Jawahar meeting you in Magic Pill session, and today it is actually part 2 of oncology and chemotherapy. Okay, the questions what we are discussing is related to oncology and chemotherapy. Already part 1 is there streaming in e-nursing meteor YouTube channel. Please watch the video and then please come to part 2. Okay, so both are having connectivities. Okay, fine. And if you like the videos, please like it, share it, and subscribe the channel. So let's begin the session without wasting the time. Fine. Fluorouracil is classification under the dash category of drugs. So this is the question. Fluorouracil is classification under dash category of drugs. Actually, they are asking the classifications. Okay, and let's see the options. Alkylating agents, anti-tumor antibodies, antibiotics, plant alkaloids, anti-metabolites. So these are all the 4 options they have given here, and they are asking for the classification of fluorouracil drugs. Okay, it is a cancer drugs. Among this, the right answer is what? Option D, that is anti-metabolites. Fluorouracil, it is the drug which is coming under what? Anti-metabolites. Okay, fine. So the rationale is, what is anti-metabolites? See, there are many classifications are there in anti-cancer drugs. You can see in this tabular column, see, anti-cancer drugs, they are classified broadly into 6 types. The first one is alkylating agent. The best example is cyclophosphamide. In the exam, you know, they will be asking question like this only. The cyclophosphamide is coming under which classification? The same question, this pattern only we have discussed the question now. The fluorouracil is the classification of which drug? So you have to answer anti-metabolite. Same way, the same pattern, they will be asking question for other drugs also. Okay, so you should know the classification and the examples. This is very, very important. Okay, so 6 classification. The first one is alkylating agents. The best example is cisplatin cyclophosphamide. First one is over. Second one, anti-metabolites. So that's what we discussed in this question. Okay, fluorouracil, methotrexate. See, methotrexate is very commonly used anti-cancer agent. Okay, the third one is natural product, that is vincristine. Vincristine is very commonly heard drug, right? And anti-tumor antibiotics, that is bleomycin, doxorubicin. So these 2 drugs are very common. The next one is miscellaneous, imatinib. Okay, hormonal prednisone. Okay, sorry, prednisone. Okay, so these are all the 6 types of anti-cancer drugs. Okay, so what are all the things you're supposed to know in this? First, the classification, the name of the classification, and examples of each and everything. Okay, and for this question, fluorouracil, it is coming under the classification of anti-metabolite. So what is anti-metabolite? So this question should come into your mind. What is anti-metabolite? What is the action of anti-metabolite in cancer cells? See, anti-metabolites are group of drug that interfering the DNA synthesis of the cancer cells. See, DNA synthesis is very, very important for the multiplication of the cancer cells. Okay, but this drugs, anti-metabolite, is interfering with the DNA synthesis of the cancer cells. So that is a function of anti-metabolite. For better understanding, I will be explaining along with the image. So look at the image. So this is actually a cell cycle. Okay, so always keep in mind, a cell cycle, it is having 2 phases. Actually 4 phases will be there. Okay, but among the 4 phases, 2 phases is very, very important phase. So let's start with phase 1. See, here you can see, just follow the cursor. Okay, so this is the G1, that is gap 1 phase. Here the growth will take place, growth of the cell will take place. The next one is S phase. S phase means synthesis phase, very, very important one. In this synthesis phase only, this anti-metabolite drug which we discussed now, it is acting here and it is interfering the DNA synthesis. Once again, I will repeat. The second phase in the cell cycle is S phase. The anti-metabolite drug, whatever I have mentioned now, so that drug is acting in this S phase. S phase is also called as synthesis phase. Okay, S phase, and it prevents the DNA synthesis. Clear? Yes. And the next phase is G2. It is also called as gap 2. So this is also growth and development will take place, growth and development of the cells. And the fourth phase, very, very important phase, is M phase, also called as mitosis phase. Okay, so mitosis phase, it is consists of four different stages. Okay, hope everyone understand the cell cycle. The first one is G1, also called as gap 1. It is a growth phase. Okay, the next one is S phase. It is also called as synthesis phase. Here only the DNA synthesis is going to take place. DNA formation is going to take place. So anti-metabolite drug is going to act in this S phase and interfering the cell cycle. Okay, so it is destroying the cancer cells. Okay, the third phase is G2, that is gap 2 phase. Here also growth is taking place. And the last one is M phase. It is also called as mitotic phase. It is divided into 4 stages. What are the 4 stages? Here you can see prophase, metaphase, anaphase, telophase. These are all the 4 stages of what? M phase, that is mitotic phase. Hope everyone understand the cell cycle, right? Fine. So let's move on to the next question. Among these, which cycle is cell cycle specific anti-neoplastic medication? Among these means they will be giving some 4 options and they are asking among the 4 options, which drug is cell cycle specific anti-neoplastic medication? Cell cycle specific, underline the word specific there, because there are 2 things are there, specific and non-specific. Okay, so cell cycle specific anti-neoplastic medications they are asking. So this is the key point here. So let's see the options: cisplatin, methotrexate, cyclophosphamide, and chlorambucil. So 4 drugs they have given here. So among these 4 drugs, which is cell cycle specific anti-neoplastic medication? So here the right answer is what? Option B, that is methotrexate. So why we selected methotrexate? See, as I mentioned already, there are 2 types of anti-neoplastic drugs. See, these are all very, very important points. Please take a paper and pen and please write these notes off. Okay. So there are 2 types of anti-neoplastic drugs. The first one is cell cycle specific anti-neoplastic drugs and cell cycle non-specific anti-neoplastic drug. They will be asking example in the same pattern what we are discussing. Okay, fine. So cell cycle specific anti-neoplastic drug means both the types is going to destroy the cancer cells only. Both the types is going to destroy the cancer cells only. But where it will affect, the cancer cells are destroyed, but how it is destroyed, so that matters. Okay, so cell cycle specific anti-neoplastic drug, it acts on the either S phase or M phase. Please underline the word. I'm talking about cell cycle specific anti-neoplastic drug. It acts on the 2 phases, either S phase or M phase of the cell cycle. Okay, the best example is methotrexate. Methotrexate, just now in the previous question we discussed, even in this question we are discussing about the methotrexate. In methotrexate, it is the one which is affecting the S phase of the cell cycle. Okay, whereas vinca alkaloid, it is also a cancer drug. It is acting on the M phase, mitotic phase of the cell cycle and destroying the cancer cells. Very important, guys. The next one is cell cycle non-specific anti-neoplastic drug, non-specific. Okay, so here it can act on any phase of the cell cycle. There is no specific phase it will attack. It will attack on any phase, either S phase or M phase or growth phase 1 or growth phase 2, anywhere it will attack and it will damage the cancer cells. That is called as what? Non-specific. Specifically, it will not attack. Anywhere it will attack. That's why it is called as what? Non-specific anti-neoplastic drug. And the best example is cisplatin, cyclophosphamide, chlorambucil, and busulfan. These are all very common drugs. Understand, guys? So on the whole, for this question, the cell cycle specific anti-neoplastic medication is methotrexate. It is acting on S phase. Clear? So the next one is a substance that causes tissue necrosis and damage, particularly when extravasation occurs. The cancer drugs, anti-cancer drugs, if you are administering intravenously, it is getting extravasated. What is the meaning of extravasated? The fluid or the drug, whatever you are administering, anti-cancer drug, whatever you are administering, it is leaking from the blood vessel into the tissues. This is called as what? Extravasation. Once it is leaked out of the blood vessels and enter inside the tissues, what all the changes will happen in the tissues? Okay, so that is the question they are asking here. And they are specifically saying once the fluid escape from the blood vessel enter inside the tissues, necrosis, tissue necrosis is taking place. Tissue necrosis is taking place. So which, if it is taking place, it is called as what? So this is the question. And 4 options they have given: apoptosis, interleukin, vesicants, retinoids. And here right answer is option C, that is vesicants. Okay, so the rationale behind this is vesicants is also called as blister agent. Clearly in the first golden point I have explained, vesicant means what? Blistering agent. Once it is leaked out from the blood vessel into the tissues, immediately what will happen? Blister formation will be there, tissue necrosis will take place. What will take place? Tissue injury, tissue necrosis, blister, everything will take place. So if these characteristics are happening, means it is called as what? Vesicants. So this option is matching with the question, right? So here, which is the right answer? Option C, vesicant is the right answer. Apart from that, let's see all other options also. Interleukin. What is interleukin? Interleukins are the type of cytokines. What it is? It is a type of cytokines. It is also called as inflammatory mediators. Whenever there is an inflammation, these interleukins is the one which is creating the inflammation. Interleukin is the one which is creating the inflammations. Like, you know, what is inflammation? Redness will be there, swelling will be there, capillary permeability will increase, dilatation of the blood vessels will be there, warmth will be there, fever, increase in the fever is taking place. Everything is happening because of what? Inflammatory mediators, cytokines. The best examples of inflammatory mediator are interleukins. The next one is apoptosis. Immediately, once you hear the word apoptosis, what should come into your mind? Programmed cell death. What should come into your mind? Programmed cell death. Once the lifetime of the cell is over, it will die on its own. Okay, it will die on its own. It is called as what? Programmed cell death. It is a natural phenomenon, apoptosis. The last one is retinoid. It is metabolite of vitamin A used in the treatment of cystic acne. Okay, so this is called as what? Retinoid. So hope everyone understand this question, right? So let's move on to the next one. Which laboratory result of the patient taking chemotherapy would indicate massive cell destruction occurred? Understand the question. Here the patient is taking chemotherapy drug. Okay, and you are checking the lab values to find out whether the massive cell destruction happened or not. Patient is taking chemotherapy drug. Because of the chemotherapy drug, massive destruction of the cell happened or not, that you are going to find out with a lab report. Okay, so what test or what you have to check in the lab report? So this is the question. And they have given 4 options like increase uric acid level in blood, decrease uric acid level in blood, decrease bleeding time, hypernatremia. 4 options they have given here. And here the right answer is what? Option A, that is increased uric acid level in the blood. What is that? Increase uric acid level in the blood. How it is possible? Why I have selected this option? See, whenever there is a destruction of your cell, whenever there is a destruction of your cell, whether it is a normal cell or abnormal cell, immediately what will happen? The DNA and RNA will get metabolized. If the cell is destroyed, means what will the DNA and RNA do? It will also metabolize. It will also destroy. Once the DNA and RNA is metabolized, immediately what is formed? Uric acid is formed. If you are giving chemotherapy for a patient, what is the purpose of giving chemotherapy? For destroying the cancer cells. Am I right? So by giving chemotherapy, we are destroying the cancer cells, means the cancer cell is also having what? DNA or RNA. So that one will get metabolized, and what will release? The uric acid will release excessively. If uric acid is increased in the blood, that time it shows that the chemotherapy is creating a massive cell destruction. Massive cell destruction. So this is the rationale behind this. Okay, guys. So the next question is, the last question is, the term nadir, N-A-D-I-R, used in chemotherapy means. Okay. Extensive loss of hair, direct question. Okay. Extensive loss of hair, effectiveness of chemotherapy, low blood cell count, extreme side effect. These are all the 4 options they have given here. And the question what they are asking is, the key point is nadir, N-A-D-I-R, in chemotherapy. Okay. So here the right answer is what? Option C, that is low blood cell count. What is nadir? when you are giving chemotherapy drugs, it will cause myelosuppression. What is myelosuppression? Suppressing the bone marrow. The bone marrow is the one which is producing WBC, RBC, platelet. All these cells are produced from the bone marrow. If you are suppressing the bone marrow by means of giving chemotherapy drugs, even the cancer cells are produced in the bone marrow. If you take, ALL, acute lymphocytic leukemia, here the cancer cells are produced in the bone marrow. In that case, what are you supposed to do? You have to give chemotherapy which is targeting the bone marrow. Once the chemotherapy is targeting the bone marrow, automatically the bone marrow suppression will take place. That is also called as what? Myelosuppression. So once the bone marrow is suppressed, all the blood cell count, especially RBC, WBC, platelet will decrease. So that's why we selected what? Option C. So here, nadir period means once you started the chemotherapy, within 1 or 2 weeks, underline the word, within 7 days or 7 to 10 days, you can expect the decrease in the low blood cells like WBC, RBC, platelet, especially WBC neutrophil level will be decreased. That's why the patient is prone for what? Infection. So whenever the patient is having chemotherapy drugs, usually the physician used to say that, please check for the temperature. If the temperature is decreased and there is a chances for bleeding, or the patient is suffering from anemia, HB level is decreased means it shows that the myelosuppression is already happened. So you have to take care of what? HB, prevent infections by following the sterile techniques, check for anemia, that is HB, and check for bleeding. Okay, so by thinking about all these things, so the right answer related to this nadir is low blood cell count. So hope everyone understand all the questions, whatever I have discussed. So let's meet in another magic pill session. If you like the video, please like it, share it. And if you without subscribing the channel, many viewers are watching this videos. Please subscribe the channel. If you are subscribing, it will motivate us more and more. Okay. Thank you very much and all the best for your upcoming examinations.